Do you remember that vena cava superior goes where? Where to, Dr. Ramupa?
Upper extremity.
Huh?
Brain, up.
Brain.
Up.
Так? Vena cava superior flows to the brain.
No, not.
In your brain only,
No.
maybe. Right ventricle, not left ventricle. So here is the vena cava superior, this one, which goes to the which opens into the right ventricle, like that. And you know that blood through the veins goes to the heart, not away. Understood? So, how this vein is formed? Vena cava superior is formed by connection of two veins. They are called vena brachiocephalica. Two vena brachiocephalica unite together and form vena cava superior. So here I want to tell you, please don't be confused, because very often you say that vein has branches. No branches in veins. Branches are in arteries only. But veins have inflows. That's why vena cava superior, it is formed. It is not bifurcate into two veins, because only arteries can bifurcate. But veins are formed by two veins. Understood this in terminology? So this vein is formed by connection of two veins, vena brachiocephalica. Or you can say that vena brachiocephalica are inflows of vena cava superior. Did you understand? So blood flows like that. Then you can see that vena brachiocephalica sinistra on the left side is longer than right one. Why? Because vena cava superior is formed at the level of connection right first rib with the sternum. That's why left vein must be longer than right one. Vena brachiocephalica itself also is formed by connection of two veins. First vein is the basic vein on the neck. It is called vena jugularis interna, internal jugular vein, which collects blood from the head and neck. And another vein is called vena subclavian, which collects blood from the upper extremity. No? Did you finish? Did you draw this? And now I want to pay attention that this connection between vena jugularis interna and vena subclavia, in the region of this connection, we have angle. And this angle is called angulus venosus, venous angle. It will be very important in a chapter of lymphology. So on this side also, vena jugularis interna and vena subclavia, they unite together to form vena brachiocephalica. Well, except vena jugularis interna, on the neck we have vena jugularis externa, which is a little bit laterally, but medially closer to the anterior side of the neck. We have two more veins. They are called vena jugularis anterior. This vena jugularis anterior pass on both sides of our larynx. You remember that lower part of larynx contains gland which is called thyroid gland. And now is very important moment that two veins, two vena jugularis anterior, are connected with one another with the help of this junction. And this junction is called arcus venosus juguli. This one. Arcus venosus juguli. And this arcus venosus juguli is located just under the thyroid gland. This arch is not permanent, is not constant. Sometimes this arch can be absent, and not in all textbooks this arch is written. But I wanted to remember and keep in mind that in all your patients this arch must be. Remember this information. Even if this arch will be absent, you have to think about presence of this arch. Why? Because these veins of the neck, have very important feature. Almost all of them have pressure which is lower than atmospheric pressure. Lower. That is why during surgery, if you cut any vein on the neck, because of lower pressure, air will be absorbed into veins. But you remember that air cannot be compressed. And this embol, this air will go to this vein, then this vein, then this vein. These veins are large, no any problems will be. But when this bulb of air will go to the smaller vessel, it closes vessel and air embolism will be. If air embolism will happen, patient will die. Understood this? Huh? No. It's same like clot. If we close the vessel with the help of clot, that is why patient will die. Same air. Because of air embolism, patient will die. And you cannot help. Because you don't know in which vessel will be this closer. Maybe vessel of the brain, maybe vessel of the heart, maybe vessel of the lungs. You don't know. That's why you cannot help. That's why you have to be very operate with attention, great attention in this region, because this region is very dangerous, especially when you carry out operation on the thyroid gland. Because if these vessels are written in all textbook, arcus venosus jugulae, not in all, and sometimes you can forget about this arc, cut it, and patient will die. Understood this? Understood. Very good. If you understand this, now let's talk about another is venous outflow from brain. Venous outflow of brain. This information is what? This information is not given in textbook. But venous outflow from brain goes in three directions. In three directions. And this is very important to know because our brain is located inside this copybook. And this is the copybook. What is Javisha? Well, venous outflow of brain is very important because our brain lies in the cranial cavity. And very often we have hypertension, intracranial hypertension, when pressure inside of skull will increase. And any increase of pressure can compress our brain, and our brain is very sensitive for this compression. And after this compression, you can feel a lot of neurological symptoms. For example, headache, maybe something else, maybe paralysis, maybe loss of sensitivity, like that. That's why in our brain, there are three different ways of venous outflow. First one, the most important, the basic, is internal jugular vein. Internal jugular vein, or through the sinuses, or sinus. Sinus, which you will be studying next time, is sinus of Duramar. So this vein is the most important. So this vein, vena jugularis interna, is the basic vein which collects blood from our brain. Approximately 90% of all blood goes to the vena jugularis interna. Second way is through the emissary veins. Emissary veins. Small veins which pass through the openings in the skull. Which openings of the skull do you contribute? Foramen magnum, well, get me. Foramen lacerum, foramen. Manisha. spinosum, foramen parietale, foramen mastoidum, foramen ovale, foramen rotundum, a lot of openings. So through these openings, small veins goes from skull to the outside, and they connect intracranial structures with extracranial veins. No, and last way is diploatic veins. Diploatic veins. Diploatic veins. Do you know what is diploa? Sashikant? What is diploa? Nobody knows what. Huh?
Two sets of something.
There is dichotomous.
Diploa. So, from the first semester, you have to know that our bones, all bones, can be divided into which groups? Which types of bones do you know?
Paired and
Which one?
paired and unpaired.
Flat bones,
Ah,
tubular bones,
long,
No.
spongy,
long.
No.
There's long. 5.
oh my god, first class, first semester. And mixed. How do you think? Bones of skull cap, to which group belong? From these four. Flat, tubular, spongy, and mixed.
Flat.
Of course, bones, flat bones, but flat bones are subdivided into two parts. Flat bones of skull and flat bones of girdle, for example, scapula. So, and now I want to ask, what is the difference between flat bones of girdle, between scapula, and for example, between parietal bone, which is typical flat bone? They have sinuses, and which sinus do you have in your parietal bone? Parietal sinus. Javisha, don't surprise me.
They have those. They have sulcus. Sulcus.
Flat, spongy, tubular, and mixed. There is division on the base of what?
On the shape.
No.
On the shape.
The.
Ninth group is divided into two parts only. How do you think it will be shown? All students of ninth group can be divided into two. Which one? On the matter. On the matter. Ninth group is divided into two groups according to matter. Huh? Composition. According to the structure. According to the structure. Now we are talking about bones, not about students of ninth group. Right? So, according to the structure, that's why I have to find difference between flat bone of the girdle and flat bone of the skull. So, flat bones of skull, no, for example, parietal bone, no, here is the, here I will talk. For example, these are two parietal bones. Two parietal bones which are connected with the help of what?
Font.
Suture, which one?
Lamboidy.
Sagittarius, sutura Sagittarius, because it passes between two parietal bones. So, and our parietal bone has two plates, lamina externa and lamina interna. Who remembers second name of lamina interna?
The one with 3 S's.
This one, lamina,
Again. YouTube done that bad.
lamina, this one internal jugular, posterior, emissary veins, sorry. This one, lamina vitrea, of course. Lamina vitrea. What is the meaning of this vitrea? Vitrea, what is this? It means glass. Vitrea means glass. Right? That's why this lamina is very thin, and very easy to damage it. What is between two lamina? What is between them? Between lamina externa and lamina interna or lamina vitrea? What is this? What is this? How the spaces are called?
Durame? No.
Dura mater.
No, that's.
Lupus brain also.
No.
Depression. Diploid. This diploid. Well, what is diploid?
They are space.
Diploid, they are cells, spaces, which are filled by what? Same spaces I can find in the spongy bones. But do you remember in spongy bones, what are they filled by?
Trabecule? Bone trabecule?
What are they filled by? Air in spongy, for example, sternum. What is it, if I cut sternum, what can I find inside of these spaces?
Bone marrow. Bone marrow.
Huh?
Marrow?
Which one?
Red. Bone
Red
marrow.
bone marrow. But same structures can be found in a diploid, but what are they filled by?
Veins.
Arteries, veins. Oh my god. They filled by air. Air. For making of our skull lighter. So these spaces, this diploid in norm is filled by air. Understood this?
So why don't we call it sinuses then? Sinuses are larger than the.
Of course, sinuses are very large cavities. This small, what like in this spongy. Same. Then there is dura mater. Dura mater is coat of the brain, which covers bones of skull from inside, and very tightly attached to the skull bones, like that. But in the region of this sutura sagittalis, dura mater goes out from bones of skull, like that, and now it forms process. There is process of dura mater which passes between two hemispheres of the brain. So this process of dura mater is called falx cerebri. And somewhere between two hemispheres, this layer continues into this one. Understood? And now here between hemispheres, I get two cavities. First cavity is this one, which is formed by only dura mater, and another cavity is this one, which is formed by dura mater and bone. Both cavities are called sinus of dura mater. This sinus is called sinus sagittalis inferior because it passes sagittally and is below. This one sinus sagittalis superior. Both of them are filled by venous blood. These sinuses differ from veins because veins also are present in the skull, inside of skull. But what is the basic difference between sinus and veins? Sinuses are formed by hard walls. They are formed by dura mater, which is very dense connective tissue, and bones. That is why this sinus cannot be collapsed. When we have very high intracranial pressure, that is why veins can be compressed by this pressure. And if vein is compressed, that's why blood cannot flow out. Blood will be accumulated in the brain, and its secondary cause increasing of the pressure. Pressure will be increased, it presses on the veins more with greater force, and of course it will be like cycle. I compress vein increase pressure, pressure compress the vein, and like that. That is why in this cranial cavity we have sinuses which cannot be compressed. Even if pressure will be very high, these sinuses will be opened and venous outflow remain. Understood this? That is why now, before we said about openings in the skull, our parietal bone has opening also, which is called foramen parietale. Maybe you remember this opening. From one side, foramen parietale opens into sinus sagittalis superior, but from another side, this foramen parietale opens into subcutaneous vein of the head. This vein, this skin, and subcutaneous vein. And this foramen parietale contains very small vein, which in normal conditions this vein is collapsed. When intracranial pressure is increased, that is why this pressure compresses the veins of the brain, and almost all blood goes to the sinuses, because cavity of sinus cannot be compressed. That's why pressure in sinuses will increase. This blood will press into this vein, which is inside of this opening, and then after this blood will flow through this vein into a superficial vein. So when this vein delayed during increasing intracranial pressure, this vein is called emissary vein. Emissary vein. With the help of emissary vein, our blood also can go out to the superficial veins. And now these superficial veins receive great amount of blood, and on the face of your patient you can see large veins, enlarged veins. So if you see veins on the face, which in norm cannot be visible, that's why you can think that pressure inside of skull is increased. Understood? Then, these veins, vena emissaria, has small openings. And when blood flows out this sinus through the vena emissaria, through these openings blood flows to the diploatic spaces. And now these diploatic spaces, which in norm contain air, are transformed into diploatic veins. And you know that this air, which is present in diploa, makes our head lighter. But when, in this case, these spaces are filled by blood, what will be? Patient will feel heavy of the head. The head will be heavier than in normal. Sometimes it is only one symptom of patient. He will come to you and will say, "Doctor, I feel heaviness in my head." No more symptoms, only heaviness. So you have to think that maybe he has chronic increasing intracranial pressure. Something wrong with this mechanism. Understood this? Understood. Well, that's why this, now I explained all this, internal jugular, emissary and diploatic veins. So here on this schema, I just show you how sinuses are formed. But on next class, you yourself must prepare all sinuses, because a lot of sinuses are in our skull. And now I will not explain them because you don't know them and it will be very difficult to understand. So at home you have to prepare yourself the sinuses, and then on next class we will discuss. Questions?